Hello, and I hope you hear us well, and I hope you can see the first slide. So my name is Dr. Nadav Pam, and I'm the clinical director of Formatec, and with me is the Alpha system right here next to me. And let's us begin. Can you confirm that you can see the screen? You can? That's what I'm sharing?
Yes.
Okay. So let's go in. So I'm going to speak with you today about the Alpha system and to explain to you its benefits. But before we start with that, let me explain that the system contains IPL and diode and a melanometer that is with us here. And first of all, let's dive into the IPL. Our IPL system is called 3D. It means that you can control the fluence, the tip pulling effect of it, and the pulse width. And all of this is to enable you the precise results that you want to get. Right now, I'm going to speak about the treatment of pigmentation. This is from aging or from solar. And we have a new protocol that we have created. We call it Tight and Bright. In the industry in the past, people thought that in order to have successful results, you need to have very high joules. And we will show you today that we can do it even with low joules and high hertz. And in this way, create a new protocol that's called Tight and Bright. And you get correction and prevention of signs of aging for the face, décolleté, and for the back of the hands. You see the screen when I'm changing? Okay, good.
Yes.
So today we will focus in the next meeting on the IPL technology, and later on, if we have time, we'll talk also about the power motion. Those are two key concepts that are unique for Formatec. In addition, we have a melanin meter. The melanin meter is a very important topic. It allows us to choose safe parameters based on reading of two layers of pigmentation, one superficial and one is deep. The superficial is something that we can see right now. The deep is something that will only be visible later on when we mature, or if we use specific cameras. The idea is that you will get a number between 0 to 100, and this will correlate to 6 skin types and 3 sets of parameters, and with this will have high safety. We are one of the only few companies in the world that has a mandatory melanin meter in order to analyze each anatomical area where we are going to treat to find the correct parameters that you need to perform in order to achieve first safety for the patient, clinical results, regulatory standard, and at the end, this will give you the complete package. And it's not about guessing game, because if with skin type 1 till 3, when you do a patch test, which is mandatory with a new patient, you need to wait 30 minutes to 1 hour to see the full effect. But skin type 4 and above requires even up to 48 and sometimes 72 hours because it has a delayed effect. We offer a scientific way to diagnose the skin before we start the treatment. We have over 20 approved indications, and this is the melanin meter. So regardless if you are using our diode laser or IPL, in every specific anatomic area, you will measure with the melanin meter and put that data from 0 to 100 into the machine, and then you will get the preset of pulse width, hertz, and fluence. This will provide high safety profile for the patient, because as we know, even though that I'm supposed to be skin type 2, in every person we have shades due to sun exposure or to scratching or itching, which creates melanin. And even in one single person, you have the need to use different parameters for many different reasons. And with this analyzing tool, you get the digital diagnostic correctness to match the parameters, so you avoid side effects. As I explained, 3D means you get control over energy, pulse width, and cooling intensity. We know that undercooling or overcooling can change the result. Therefore, you have the control for that. So this is the balance between overcooling and undercooling. You can cancel the contact cooling. You can create it at 5 degrees, 10 degrees, or 15 degrees, depend on the what you want to treat and the indication. In our IPL, we have presets protocol. Obviously, you can also do manual and override them. You have the melanin meter. You can go with the power with the S version up to 45 joules. You have pulse width control, cooling intensity control with the sapphire glass, and 4-wave selection. What's the idea of Tight and Bright? We wanted to create a treatment protocol that will affect both pigmented lesions, freckles, age spots, vascular lesions, small blood vessels, even rosacea, and skin laxity in one protocol without the need to use any other technology or injections. The approach is by 2 mandatory steps and 1 optional. And I'm going to explain to you step by step how we do it. And for the marketing point, it's results with comfort, pigmentation and texture, and corrective and prevention. How do we perform it? If a woman at the age of 30 or 40 arrives to your clinic, she might think that she doesn't have signs of aging, but with the correct photo, with the correct device, you can show that she already has severe sun damage. If she starts treating at earlier age, she will avoid signs of aging later on. So in this way, we do prevention and correction. So how do we actually do it? With our IPL, we can reach up to 9 Hertz per second. When you reach to 9 Hertz per second, you can accumulate on the skin surface up to 40 to 42 degrees for at least 2 minutes. In the past, people thought that you can only do this with radio frequency, but we have proved that with our IPL with 9 Hertz, you can achieve it as well, because the skin always wants to cool down. But if you manage to reach to 9 Hertz per second, you will accumulate heat very, very fast. What this heat does? Basically, it's a controlled thermal injury to the dermis, inducing neocollagenesis, elastogenesis, and angiogenesis, thermal remodeling, leading your skin to become healthier. So it corrects itself without the need for anything else. We know today that if you do injection, for example, botulinum toxin, your body will develop resistance. To this method, there is no resistance. You can treat the forehead, the cheeks, under the jaw, lateral neck, décolleté and back of the hands easily and fast results, and there is no downtime for the patient. This is the way that the screen looks like. So you do phase 1, phase 2. Basically, this is how the screen looks. You press 1, skin type according to melanin meter, you choose Tight and Bright, you'll get the parameters. After that, you choose phase 2 and continue. So what's the idea of the data behind it? If you look at the screen right now, you will notice that on phase 1, we do 10% overlap, single stamping. We choose in skin type 1, 18 joule, mode single, 1 Hertz, pulse duration is 15, temperature is 5, 10% overlap. For example, I will treat the entire cheek. After that, I will choose step 2. The preset will change the energy to 10 joules, triple, 3 Hertz, this is 9 pulses per second, pulse duration is 5, and tip temperature is off. How will I perform it on the patient? The patient has protective glasses, and I will tell them in their own language, if the skin feels too hot, lift the hand, and immediately I will move to the next area. We are supposed to do a linear up and down motion that is gliding over the skin in a form of ironing, and up to 25 pulses. Remember that if the area has more fatty tissue, you will need 25 pulses. But if you are close to the lips, or the area is more thin, like the forehead, or it's a small anatomical area, then you don't necessarily need always up to 25 pulses. If the patient lifts the hand, you reach to the correct temperature. The optimal solution is in a given cheek, up to 75 pulses in total. It also depends on the size of the cheek from different patients to some people are larger with their jaw, some are smaller, and therefore you will adjust the pulses according to the need. You also have a pulse counter in the screen, so you can see actually how many shots you did, and therefore calculate how much return of investment you have per treatment on an individual person. Also, you can later know what is the total amount of pulses you have from the screen on a different screen when you press the eye. So you have per treatment, and also in total on as applicator, you have 100,000 pulses. This is to show you the results day by day when you are using a little bit higher fluences than we recommend. So what happened is that you have at the same time, all the melanin will resurface and become scabs. I show it to the patient before and after. we start the treatment in order for them to know what can be as a time lapse. On our given parameters, usually we don't see such a severe cases because, as I showed you before, we start the first phase at 18 joules, and here it's 22 to 23, but I still show it just for the patient to know that this is a natural response. But in this picture, you see more downtime than what we have in the tight and bright official protocol. And the reason for that is because here the user went on higher energy than we recommend. What is the treatment interval? We say once a month because neocollagenesis takes once a month, and the average is 4 treatments. You can have more than 4 treatments. There is no limitation. First, the patient has to keep a standard of healthy skin. That means sun protection, don't smoke, and have a good lifestyle, because otherwise the aging will revert. But with this treatment, you can see results from the first treatment. So most of our patients are very happy, and you will see pictures before and after for the results. Now I will show you a video. I hope you can hear the sound. Can you hear the sound? They can hear the sound or not? They can hear or not the sound of the PPT? I will open it again. If not, they can just see it. Okay. This is a presentation, a short video on how to actually perform it. So we have step 1, it's a 10% overlap with the applicator, forehead or cheek. And then step 2, it's this gliding up and down up to 25 pulses, or the patient lifts the hand. On the forehead, usually you need less pulses because it's more thin. I will show you now also on the décolleté. So same concept, always phase 1, phase 2. Per anatomical area, we always measure with the melanin meter to get the readings, to know which skin type to choose. So there are several steps. You apply gel, you place the melanin meter result. It will help you choose skin type. This is phase 1 in this picture. You have a preset of energy, pulse width, hertz, and rate. This is 10% overlap on the entire area. The décolleté area receives response very, very rapidly, even in the same treatment. You'll see nice confluent redness. Then step 2, again, you choose the parameter, you get automatic preset, then you do safety checks. It's ready. You take the applicator, you put it through the orange loop, and then you do up and down linear motion up to 25 pulses. Again, if the patient feels that it's too hot, you immediately stop and move to the next area, even if you didn't finish 25 pulses. Décolleté is not an anatomical area for different females according to their lifestyle and preferences. There is no downtime for the patient. They can go immediately to their normal daily routine. This is to show you that they can train in, this is in Romania, but I'm training at the same time, real clinics with real patients. They each one have a patient with the alpha, and they do the real treatments, and I watch it from afar and give them correction. Once they feel that they are ready and they are confident, they log off and continue with their patients in the normal daily routine. But here it was with several centers in Romania that were separated apart geographically, and we can do this training as well. It is to show you that I publish on average once a month clinical publication with the alpha, with the applicator, and I show the end customer's result. That means somebody bought from a distributor in their country, I show their own results, and you can go in ResearchGate and write Dr. Nadav Pam. All my links are for free. I write their background, aim, objective, methods, inclusion, exclusion. I write discussion and conclusion and reference and picture before and after. All my links are free to open and see. I get on average in 48 hours 200 views or downloads, and I get more than 10,000 views for my publication. Yes, it's not peer reviewed, but you can't argue with results. And now you can see that my colleague here, she used a bit higher energy than I'm using on average. and therefore our patient only had one treatment because she chose higher parameters than I recommend, then the downtime for her patient was higher. I'm showing this on purpose so you can see that you can get good results even after one treatment. But my idea is that if it took years to get the signs of aging, we'll also break it apart step by step. And I'm not in a hurry because I told the patient that they should have 4 treatments. If you do it on the parameters that I recommend, then the treatment itself will be pleasant and the patient will want to come back for the second treatment. I'm going to show you some before and after that we get from our end users around the world. Most of my pictures speak for themselves, even after 1 or 2 treatments, because you can see pigmentation disappear, you can see vascularity disappear, and you can see that the tone of the skin, because of this dermal remodeling, also tighten up. That's why we call it tight and bright. Don't work on tattoos, walk around them. In this case, you can see the mother, and then she was happy, so the daughter also came, and then her neighbor was joining us as well, even though the neighbor has severe form of skin aging signs. She is a heavy smoker. We are still able to help even in heavy-duty cases. I invite all of you to try this treatment on yourself so you can believe and experience the feeling of it. And also we exist in 45 different countries, including Asia, Latin America, and here is a treatment on a Mexican patient. So skin type 1 till 5 can all perform it without risks. Do you have any question about this topic? Okay, then the second topic that we are going to do is going to speak about monotherapy for acne vulgaris, and after that will be for rosacea. One second, I'm switching for another presentation. Okay, are you able to see the presentation? Okay, we can go on. I'm going to prove to you that monotherapy with IPL, both for acne and rosacea, is superior to drugs and to any other medical device in existence right now. So acne vulgaris is the 9th or 8th most common skin disease. 85% of adolescents will have it once. Yes, acne can appear even after adolescence. And 30% of those who have acne will transform into atrophic acne scars. So the idea is to show you how, if you treat in an inflammatory condition at the beginning of it with IPL, you avoid scars. So again, you choose the skin parameters with melanin meter. And now I hope that you will be able to hear the sound. If not, I will narrate the video. So, can you hear sound? No. Okay, so this is the pilus sebaceous unit. And basically what you see here is the follicle shaft, the hair, and the sebaceous gland. If I just make it look faster, you have dead skin cells. You have sebum production. Then the hair follicle start to enlarge because you have more and more sebum, but you can also get sweat, makeup, or oil to block it. Then more sebum comes in, and then P. acne invades and proliferates because it's an anaerobic situation. It's a microbiome. And now white blood cells comes to rush in, and a pocket of pus is forming. What's the problem? That now 70% of adolescents will try to use soap, but soap cannot affect this, but still they are doing this. The average doctor, dermatologist, family doctor, or pediatrician will try to start using isotretinoin, a drug, it's a vitamin A, through the mouth, but it will start work about 16 to 24 weeks, and a lot of blood tests and a lot of inhibitions for the patient not to get pregnant. Sometimes they're athletic, they cannot take the drug. Antibiotics, minocycline, doxycycline is up to 3 months. Sometimes you need more than one course, either with antibiotics or curatan, vitamin A derivative, and it's supposed to come through the bloodstream and then penetrates here. So isotretinoin vitamin A derivative will work on the sebaceous gland, try to eliminate it here, and the antibiotics will try to break the cell wall over here. The problem is P. acne is already 40% resistant, and we know that we're not producing more new antibiotics from the 90s. And it takes so long, sometimes up to a year with isotretinoin, and sometimes you need more than one dose. So who is going to wait that time? With IPL, you basically put the gel and you shoot one IPL flash. It will kill the bacteria. The heat will reduce the inflammation and no more acne. So what's the ratio? One single IPL flash to inflamed lesion. I'm saying just inflamed lesion, not a black or a white head, the inflamed lesion. Anywhere in the body, doesn't matter the skin color, the results is between 72 hours to 1 week, no more acne. How many treatment intervals? Once a week. You are not preventing new acne formation. You are treating the inflamed lesion directly. How does it work? The P. acne contains a chromophore that is unique only to it and that doesn't exist in human cells. So the Propionibacterium acne contains a chromophore called copoporphyrin 3. It's absorbed the most at 430, and it will convert it into radical oxygen, destroying the cell from inside without generating resistance. In addition, the heat reduces the sebum production and decreases inflammation. So no blood test, no downtime, and if you don't believe me, have the Alpha offer free pulses for free for any patient with acne that doesn't have any contraindication and is not taking right now isotretinoin orally for the last 6 months or topical in the last 2 weeks and not any other photosensitizer drug like minocycline or doxycycline. And basically monotherapy, you shoot, you call him after 72 hours, hopefully you took a picture from before, and the acne that he had on that treatment doesn't exist anymore. And I challenge you to do so because I'm doing this in 45 countries and I haven't even failed once. So for the patient, what you see, there is inflamed acne, one single pulse, and the acne is gone. In this way, you prevent scar formation. Right now in the market, we have also, beyond the oral drugs and topical drugs, in the topical, when the tube is always getting smaller and you ask the patient to apply it on the back, he's not able to do so alone. And some of it will be absorbed to the skin of the finger, and it takes compliance and also a lot of time. So let's talk about other devices. You have low light therapy. One of my biggest publications in Harvard and with my father was a dermatologist. We published about it. It takes 3 times a week, 3 months. If you want to treat face, chest, and back, it will take you an hour and a half, and it's not that effective, but it's very cheap. The other option is another device. It's 1726. It works on the sebum gland, similar to isotretinoin. The fact is the device is extremely expensive. Each treatment is extremely expensive, and it's just for that indication. So the return of investment with the Alpha on the IPL has the highest return of investment, 1-to-1 ratio, 100,000 pulses. You only have to wait up to a week to see already the results. How much you have to maintain it, it really depends. Usually the average session is about 4 to 6 treatments. It's individually based. If the patient at the beginning doesn't believe you, give him some free samples of pulses for free, call him a week, and then he will be ready to sign for more treatment sessions. But the result is the fastest in the market and with no downtime for the patient. So if the patient is under 18, the parents sign informed consent and they can come in between lunch breaks and they can do all their physical activity, especially if they're athletes and they cannot take drug, or if they have drug phobia for any reason, or they cannot swallow, or they had already a side effect for several drugs. So with IPL, they don't have to worry about it. This is a publication from 2018 that we have with our system. It was published with Indian skin type 46, and acne grade 3 to 4. And the patients were 21 to 30. It was 100 female patients from Indian origin, and they had 80% reduction in severe form or moderate to severe form of acne vulgaris with just 7 jowls. So why don't you know about it so much? I don't know, but it's in PubMed from 2018, and we have much more publication about this. So I hope that you will start believing us and start using IPL rather than drugs. This is for my colleague, Dr. Nam. He's a dermatologist from Vietnam. And this is 6 weeks. That means once a week, they got a single treatment. And in a severe case, it will take me 15 minutes to treat face, chest, and back. In a mild case, it will take me seconds. And you can agree that if I show this picture of the before to an average dermatologist, family doctor, or pediatrician, they will first consult to take a drug and not IPL, unfortunately. So I'm trying to change the system. Another patient, another patient, another patient, another. And this is a special case. This guy is a boxer. He came with scars before his mother bought the device from us. And once she started to treat him, she basically managed to bring him, while he's still an active boxer with helmets and everything, to his baseline condition with just the scars. If she would have bought the device before that, he would have a clear face with no scars at all, without the need to use drugs. This is a Formula 4 driver. He cannot take any drugs because he will be disqualified. He has high level of testosterone. He came to me already with scars. The cosmetician was treating him poorly. And I told him that maybe we need once or twice a week, but he can have the treatment before and after every flight, and he flies a lot. And we managed to bring him to his baseline condition, even while he is actively competing in sports. This will not disqualify him. Also, you can see on the back, a lot of time, female patients, they come from the shower and the hair is very wet and it attached the body. So they have also acne on their back. Some patients, they go to gym and they use tight clothes and they don't shower well. So you also need to educate them in order to prevent acne conditions. You can see on the back as well. So each one of them will just require one single pulse at low joules, so there is no risk for the skin. So I'm now going to go to rosacea. So let's start with rosacea. Currently, there is no cure for rosacea, not for doctors, not for medical device. Rosacea is chronic, multifactorial skin disease with multiple triggers: alcohol, stress, exposure to UVB sunlight, and etc., etc., etc. So it starts at the age of 20 to 30. Without treatment, will just get worse. Again, melanin meter. So according to the European, it either starts at the age of 20 or 30 and then just exacerbates. We have these 4 classical types: type 1, type 2, type 3, type 4, but any patient can have a combination with them. I'm just showing you that from the 1998, so many publications has been published about non-pharmacological way to approach, for example, with IPL and other technologies to treat rosacea, yet still not mainstream, even though there is so much evidence that supports it. In 2017, a Swiss dermatological task force analyzed everything that is in the market, from topical drugs by prescription to oral drugs by prescription, and IPL had 3 classes already in 2017, and yet still it's not accepted to be the first line. And I'm telling this to the doctors: use this, because what is an average dermatologist does, it just skips between different drugs. They will all fail at the end, or maybe it was beginning success and then failure, or it will fail even at the beginning, but at the end, the patient is getting tired from getting different consultations by different dermatologists with no results. So they are getting angry about this because the doctor is not completely honest with them that they are going to fail it from the age of 30 to the age of 60. And we know another thing is that the older we get, there is polypharmacy, and then you have to switch drugs, which each drug it has its own side effects and blood monitoring and everything. Why don't you offer as a first line IPL? And I will prove it to you that it works, just like the Swiss Task Force of Dermatology showed it already at 2017 after checking all the available data that was already there. We know that on the adult skin, we have Demodex, and probably in every rosacea will have Demodex. Why I'm telling you this? Because Demodex lives on our skin in the hair follicle. It eats the sebum, comes out on the skin, and then mate. You can see it with the dermoscope, the tails of it, or in a histological punch biopsy, cross-sectional or transverse, and you will see part of this. What's the problem with the Demodex? So there is a theory about it. I don't know which theory is more correct. if you have more rosacea, you have more Demodex, or you have more Demodex, then you have more rosacea. But the thing is, it coexists together. We know that the Demodex is heat sensitive and heat liable. That means if you apply the flash of the IPL from the thermal heat, it will decrease. The Demodex creates a signal of inflammatory cascade, telling the body create more VEGF factor. That means create more blood vessels, just like a trigger of being exposed to the sun. So if we apply the IPL, you reduce the number of Demodex in the area of treatment, and the blood vessel itself has oxyhemoglobin as part of its, as a chromophore. It will also accept the energy from the IPL and become gray, and then the blood vessel and the redness will decrease. So together, you take all of this vicious cycle and reduce it. What does the patient receives? Not a cure, but for him, the disease is not apparent on the skin. So you treat on average of 3 months and you get 4 months with no rosacea. I think it's a good deal compared then to go to all your dermatologists and basically replacing a drug after drug after drug for years with no results. And we know that the more you take the drug, the chance of drug complications, drug side effects is increasing, depends on each drug. And also it's limiting because you have to do a lot of blood tests and hope that they will continue the result and that the patient will have compliance. We know that a lot of patients don't have compliance to drugs, and a lot of times that you give them the drugs, they don't do it, or they don't do the blood test like they need. So not every patient can do this. So if you have IPL, there is no need for this anymore. So I just show you that how does the S530 works. This is 530 nanometer. You can also do it with 590. What is the difference? 590 as a bandwidth has higher affinity for oxyhemoglobin and less for melanin, so it's more safer in darker skin tones, 345. And you can and also it penetrates a bit deeper. The penetrance of IPL from skin surface is about 2 to 3 millimeters. 530 can treat also vascularity, but it has higher affinity for melanin than oxyhemoglobin. So I'm showing you here a target treatment for a chromophore, reduced Demodex, suitable for Asian or Latin America skin type, if let's say they are not just originated from European descendants, let's say from our Aztec descendants. So you affect it with a practical and friendly approach with high compliance. This is a patient that has second degree in psychology. He went to his dermatologist after they failed all known drugs. And I repeat, all of it. As a last result, they send them to me to get free treatments in the factory. And I offer this for their pictures of before and after. He chose not to treat the area of the beard. It's his preference. And I basically treated him and I returned him after 3 months to his natural skin tone. So I didn't cure him, but I gave remedy in a sort to his condition. And for him, this was a satisfactory result. This condition lasts for about 4 months. You know that rosacea can flare up individually at any given time. So that we start the treatment at 1 week interval, and according to clinical progression, the clinician, the one who operates the device, decides if the next treatment will be once every 2 weeks or 3 weeks. It's really individually based, depends on what was the severity when they arrived. But on average, 3 months treatment will give them quiet for 4 months, and then rosacea will come back, and then you will give them maintenance. What with the drugs? You would still have to treat them if you would just treat with the drugs for many months to years. So in here, I'm just showing you a new treatment approach, just monotherapy. You can see more results. And it's also, when I say rosacea, rosacea has a component of cuprous redness, but also of the telangiectasia. Anything that is in the realm of redness on the face, it will solve, especially because it's very, very superficial. So also on the wing of the nose, tip of the nose. You can see here other pictures. And this is by my colleague, Dr. Pam. This is for Asian skin type, monotherapy with rosacea only with the 590. Also, I highly recommend you that you search my name, Dr. Nadav Pam, in Google, ResearchGate, Instagram, Facebook, LinkedIn, and follow my monthly publication and read it and see exactly how I use it. So if you own the device, you can replicate these results with your patient with high success and high return of investment Again, patient safety, clinical results, regulatory standards, and marketing. Thank you very much for your listening. Questions? If you don't have right now, you can later send it to the distributor and they will translate it to me and I will write it to you back. Daniel, you want to say something?
Bueno, les agradecemos a todos por la presencia, por habernos escuchado. Esperamos realmente las preguntas, inquietudes y bueno, y por supuesto que puedan tener la oportunidad de probar este equipo con todos los beneficios que les pueden dar a vuestras clínicas. Un gran saludo y bueno, y nos vemos dentro de poco.